So cesarean section, normally known as or called C-section, is a surgical procedure made to deliver a baby through cuts made on the mother's abdomen and then uterus, okay, to bring out the baby. You understand? This is normally done. It could be planned, and it's also done if there is emergency. Okay, emergency as to save the baby or the mother or even both. Okay, so it's normal to have a C-section. It's not a problem at all. You can opt for it or you can give birth through the vaginal. Okay, these are common reasons why C-section is done. When the baby is in breech, that's normally the baby has to come with the head. Okay, so the nurses will hold the head and turn it in a certain way to pull the baby out as you push. Okay, so if the baby doesn't come out with the head and coming out with the feet, then the baby is in a breech position. Okay, so with that, the baby could die. Yeah, it's a possibility the baby could die. So the safest thing to do is to cut the mother's abdomen to bring out the baby. Okay, another thing too is if the baby is in distress, maybe it's not time yet for you to deliver your baby, but they realize the baby is suffering or cannot breathe properly. You know, sometimes the umbilical cord wraps the baby's neck or something, so the baby is in distress. In that case, since you're not in labor yet, C-section is the option you can go for, or C-section is the option you may be recommended to undergo. Another reason could also be that labor is not progressing normally. Like, you know, the normal labor we have to go through with you having pains and cramps and all of that. Yours is not progressing and you're 41 weeks, you're 42 weeks, and ongoing. Then either induced labor or you just have to undergo cesarean section. Another thing too, if you have multiple babies, like you have babies in your womb, you have about 3-4 babies in your womb, I think the best option is cesarean section because you cannot be pushing the baby one after the other. I don't know if people do push out 4 babies. Yeah, I don't know, but normally what I see is they undergo C-section. Okay, if you also have issues with your placenta, you know, you have issues with your placenta, then you may undergo C-section. And if you, the mother, is also not too well or have any kind of problem that will affect your child and yourself, yeah, you may undergo C-section. Okay, so these are the common reasons why people undergo C-section. And then also, let's say you were involved in an accident, and you realize that maybe you are 30 weeks or 35 weeks pregnant, involved in an accident. That moment, they check your heart rate, they check the baby's heart rate, and everything is okay. Or that moment, if the baby is in distress or something, CS has to be undergone so that you don't have any issues in the future. Okay. Also, if you've undergone C-section before, yeah, you gave birth through C-section before a second pregnancy, you may undergo C-section again. I don't know why, but yeah, because my first pregnancy I went for C-section. The second one, they said I cannot give birth the vaginal way, I'll have to undergo another C-section. So I'm a 2-time C-section mom and I'm proud of it. Okay, so this is another reason why you may undergo C-section. So this is how you can care for yourself after your first C-section, or yeah, after C-section. That's when you are fully discharged and you are home. First thing I would say is do not eat heavy meals. Do not eat heavy meals, because when you go to the washroom, when you go to the washroom, the pressure is on your waist, and that waist, like abdomen, that's where it's been staged. And if you strain yourself, okay, if you strain yourself, you're going to feel pain. So please do not eat heavy meals. Consider drinking, taking Lipton, hot Lipton. It helps to heal you quickly. Okay, it will heal you quickly. And then drink soup instead of chewing maybe granules and maize and all that. Drink soup, and then fish. Soup and fish. I think it will help you. Another thing, do not lift heavy things. Things that are heavier than your baby, please do not lift them. Because your baby, you will lift your baby, so you can lift things. But things that are heavier than you or heavier than your baby, like lifting water, washing, straining yourself, and doing vigorous home chores or house chores, please, please, please take your time. You will heal. As you heal, you can do that. Please take your time. Do not lift heavy things. Okay. Another thing, do not start exercising as if you want to be slim or be fit within 2 days. Please, just relax. Relax. It's not time yet. Okay? Relax. Get healed. Else you're going to get infected. You're going to put pressure on the pain. You're going to put pressure on your stomach, and it's going to really hurt you. So please, I didn't get this advice in my first delivery, but I learned it the hard way. In my second delivery, nobody will tell me. I did everything. So please, please, please do not start exercising. Okay, please take your time. Take your time till you are fully healed. Then you can start. Another thing you have to do, rest. Okay? Rest. If you feel like you need to sleep, if your baby is asleep, please sleep. Because once the baby is awake, you have to be awake to feed the baby and all of that. So please have enough rest. Okay? Please have enough rest. Another thing to do is, if people are making or requesting to help you, that's home chores and all of that, if you're okay with them, please allow them to help you, because you'll be needing help at this stage of your life. You'll be needing help with bathing the child or cleaning the child, because it will be difficult for you to be tending. It's not easy. So please allow them to help you so you can heal properly and faster. Else your healing process is going to take a very long time. So allow people to help. Okay. Do not start taking herbal medications telling you that you're going to heal faster. Don't take herbal medications now, please. Allow yourself to get healed. Allow yourself to get healed. Do not apply any hot substance at the incision area when you are not fully healed. Please. Another thing is, do not take your bath. Do not take your bath till you are fully healed. Do not pour water on yourself till you are fully. The incision area is closed. Fully closed. There is no hole anywhere. There is nothing. It's fully closed. Then you can take proper bath. But then in the meantime, you can be cleaning yourself with towel. Okay, you dip the towel in the water, squeeze it properly, and clean yourself with a towel. For the time being, do not stress yourself. Have enough rest. Allow people to help you. Do not lift heavy things. Don't eat heavy foods. Another thing is, if you're coughing or you're sneezing or you have cold, when you have cold, sometimes it comes with cough and sneezing. When you're sneezing, have a pillow Well, this pillow is too big, but have, yeah, let me get a smaller. Okay, I'll be back. Okay, so I got one. So have a pillow. When you're coughing, always make sure there's a pillow by you. So even when, yeah, when you're coughing, support your belly with a pillow. Okay, so this is your belly. When coughing, support your belly with a pillow. Hold and cough. Okay, cough, sneeze, because it's going to put pressure on the insertion area. But when you support it with the pillow, it's like your stomach rests on the pillow, so it's not going to put pressure on, yeah, where it's staged. It's really painful if you are if you've undergone surgery and then you have cold or you cough or you sneeze. It's really painful. So support your belly with a pillow. When you're feeding your child, always support your stomach with a pillow. Then you put the baby on the pillow. That's if you don't have the what's it called? The stomach support or baby support or something that you put the baby on to feed. If you do not have that, put a pillow on your laps and make sure your legs are resting, okay, upwards, straight. Put the baby on you and then so let the baby rest on the pillow, and you should also rest, relax, put your back, lean. Don't do this. Lean on the chair or your bed. Then let the baby rest on you, the pillow, and then feel comfortable. Else, you're going to strain yourself. The wound is going to get, I don't know what to even say, but please take care of yourself, okay? Do things that will make you smile instead of thinking. Okay. So this is how you can care for the wound, or I should say the incision area. Always keep the place clean and neat. Dry, clean and neat. The place has to be dry always so that you can heal properly. Okay. Do not apply creams and ointments and things that are not prescribed by the hospital. Do not do that. Okay. When you're walking, walk gently. If you need support, like support yourself, you need to get a stick or something to help you walk. Okay. But avoid sitting at one place for a very long time. Okay. Once a while, you get up, you walk gently, slowly, so that you get used to it. Okay. Drink fluids, liquids, fruits, eat fruits. It's going to help. It's going to help you recover faster. Okay. And walk gently, drink lots of water, stay hydrated, drink fluids, keep the place clean, dry, and you'll be good. Okay. Please call your doctor immediately or go back to the hospital when you see these signs. When you have severe abdominal pain, like you have severe pains, maybe one side of your leg is swollen, okay, you have fever, there is a discharge with the foul smell, you have vaginal discharge, and then there's discharge from the incision area, okay, call your doctor or go to the hospital. Do not sit at home because it can migrate into a different issue altogether. Okay, the faster or the earlier you go, the better. So visit your clinic if you have any of these signs. There's the incision area. If the place is swollen, like it's so big and red, please go back. There may be something, may be infected or something else. Go back. If you have high fever, please go back. If you have one side of your leg is swollen or even both legs are swollen, go back to the hospital. If you have abdominal pain, you are not supposed to be having abdominal pain, even though the abdominal pain. Those of you who write in the comment section that I made mistake. Okay, so abdominal pain, it does happen. That's when you are not fully recovered. Okay, it will happen, but it will go with time. So, but if it's so severe, then please visit the hospital. And also, the recovery time, usually 6 weeks thereabouts, your incision area should be closed. Yeah, from 6 weeks thereabouts. And then to be fully healed, like 12 weeks there, 12 weeks, like, yeah, that's 3 months and above, you should be fully healed. But I should say that every woman and how their healing process takes, or how the healing process goes. Some will be faster, some will be slower, some will take a lot of time and all of that. So do not be too bothered if yours is taking a little bit of time to heal. Just give yourself the time. Be patient with yourself. Eat what you're supposed to eat. Do not start eating bread and things that will constipate your tummy, or that will make you have constipation. Okay, do not start eating those things like bread, cake, and all of that. No, do not start eating sugary fruits and milk. Okay, should be Lipton or even Milo without milk and sugar, Lipton, soup, and all of that. Okay, and you'll be fine. It helps manage your weight. One, it helps heal you faster because they are hot, and when hot substance gets into your tummy, it heals you. Or if you have wound and you press it with hot water, you know that it heals faster. So that's how it is. Okay, so that's it. These are some of the things I did which helped me in my second time giving birth. Yeah, my first time I really struggled, but the second time it really helped me. So this is what you can also consider. If you have any idea or anything more you can add to what I have said, you can drop it in the comment section. I'll be so glad, and then people can also see and then know other things they can also do. What did you do? How did it go for you? Did you have it easy? How was it? Like, share your experience in the comment section for others to also see. And thank you very much for joining. Please do well to subscribe, like, and I'll see you next time in my next video. Bye.